Have you ever wondered about the difference between PCOS and PCOD? You're not alone. They may sound similar, but they are two distinct conditions that often get mistaken for one another due to their comparable names and symptoms. Polycystic ovarian disease, or PCOD, and polycystic ovarian syndrome, known as PCOS, are both disorders that affect women's reproductive health. Despite the similarities, there are significant differences between them, particularly when it comes to their causes and treatment. It's estimated that around 10% of women worldwide are diagnosed with either PCOS or PCOD at some point in their lives. The hormonal imbalances associated with these conditions can lead to a range of health complications if left undiagnosed or untreated, including diabetes, acne, hirsutism, or even infertility. But don't worry, they can be managed and regulated with proper care and treatment. Now let's delve deeper into what these two conditions are. So, what exactly are PCOS and PCOD? Let's dive right in. Polycystic ovarian disease, or PCOD, is a disorder characterized by the production of immature or partially mature eggs in the ovaries. This overproduction results in the formation of cysts. But here's the kicker. This process triggers the release of excess androgens, which are male hormones. This hormonal imbalance can lead to various complications, such as weight gain, chronic acne, and irregular menstrual cycles. On the other hand, polycystic ovarian syndrome, or PCOS, is an imbalance of female sex hormones. This imbalance can cause irregular or skipped menstrual cycles due to the overproduction of androgens. But it doesn't stop there. PCOS is classified as a metabolic disorder, meaning it can further complicate other chronic diseases, such as diabetes and heart conditions, if left untreated. These definitions may seem complex, but understanding them is key to distinguishing between the two conditions. Now, you might be wondering, what causes these conditions? The exact cause remains unknown, but leading researchers point to a couple of key factors. Firstly, excess insulin. Produced by the beta cells in the pancreas, insulin plays a crucial role in converting blood glucose into energy. However, when there's too much insulin in the bloodstream, it can lead to insulin resistance, disrupting metabolic function. More importantly, this insulin overload can spark the production of androgens, or male hormones, in females. The result? Symptoms such as excessive hair growth, acne, weight gain, and even disruptions to the ovulation process. Secondly, there's the matter of genetic predisposition. While research is still ongoing, some studies suggest a higher incidence of PCOS in women who have a family history of this condition. In other words, genetics may play a role in the occurrence of PCOS. While the causes can be complex, it's crucial to understand them to manage these conditions effectively. What are the symptoms of these conditions and how are they diagnosed? Polycystic ovarian disease and polycystic ovarian syndrome may manifest through a variety of symptoms. Common amongst them are weight gain, acne, and irregular menstrual cycles. Some women may also experience hirsutism, which is an excess of hair growth, and struggle with infertility. These symptoms result from an overproduction of androgens, also known as male hormones, in the female body. Diagnosing these conditions often involves a careful review of these symptoms and a thorough examination of a patient's medical and family history. In some cases, doctors may also perform physical examinations or order specific tests to confirm their diagnosis. It's important to note that the symptoms can vary widely from person to person, and not all individuals will experience all symptoms. Therefore, if you notice any changes in your body or menstrual cycle, it's important to consult with a healthcare provider. Remember, if you experience any of these symptoms, it's important to consult with a healthcare provider. So, what have we learned today about PCOS and PCOD? We've delved into the unique intricacies of polycystic ovarian disease and polycystic ovarian syndrome, two conditions that, while similar, have distinct differences. We've learned that these conditions are marked by hormonal imbalances that can lead to a variety of symptoms, from irregular menstrual cycles to excess hair growth and acne. We've explored the causes, including excess insulin and genetic predisposition, and we've discussed how these conditions are diagnosed. Importantly, we've underscored that these conditions affect a significant proportion of the global female population. While there's no definitive cure, lifestyle modifications and timely treatment can manage the symptoms and prevent complications. It's crucial to understand these conditions, not only because they're common, but also because they can significantly impact a woman's quality of life if left unmanaged. Remember, knowledge is power. Understanding PCOS and PCOD empowers us to take control of our health. Until next time, stay healthy and informed.